Hello everybody, and thanks very much. I'm Lucy Russell, and I'm a nurse and a board member of the Plant-based Health Professionals. And it's a great honour to stand up and talk about this. I sort of volunteered, and because it's something that I feel very passionately about. I will say that I did do out some cards for myself because I thought I'd probably get stage fright actually in such eminent company, but in fact there isn't a stage, so I may be all right. I don't know. And what I'm going to talk about will be factual and research based. It's all very shocking for me, I think, and perhaps for you too. And there won't be any need for me to ham it up at all. So, if I can talk about processed meat. So first of all, what are processed meats? So we're going to talk about its red meats, based on red meats, sausages, bacon, salami, hams, and any red meats that have been transformed through salting, curing, fermenting, smoking, or any other changes to the meat. And what all those things do is to enhance the taste of the meat, apparently, but also to pink them up, to make them look attractive rather than brownish, and to give them shelf life. So, continuing with what is this problem, as I'm sure we all know, in 2015 the World Health Organization classified processed meat as a Class 1 carcinogen. Now this report was based on the International Agency for Research on Cancer, and it was a group of 22 experts from 10 countries, and there were over 800 studies. Definitively, processed meat causes cancer. So just the top figures. So it is known to be causative of 13% of colorectal cancer cases. This is processed meat causing these cancers. And there are 5,500 cases of colorectal cancer per year. Not only does processed meat cause and risk colorectal cancer, but also other cancers and other chronic diseases. So in the UK, there are many studies, and our wonderful team have put these together, but over 12,000 deaths yearly in the UK, and that is through association with processed meat consumption. That is all-cause mortality, so that is chronic diseases, cardiovascular disease, stroke, obesity, diabetes, as well as other cancers, such as pancreatic cancer. There have been recent studies to show links with breast cancer, particularly in menopausal women. So, again, you're probably familiar with this, but the mechanism of this carcinogenicity, the nitrates and nitrites used in the processing forms nitrosamines, which have been known, and I hadn't realised, but all my lifetime it has been known that they're carcinogens to humans. Heme iron in the red meat forms N-nitroso compounds again, and also high temperature cooking of these processed meats, such as frying, roasting, and grilling, that forms heterocyclic amines and the polycyclic aromatic hydrocarbons, again known carcinogens. So, It's time to have a little look at that. We did a small survey at plant-based health professionals to find out what is the evidence. Are our hospitals indeed serving processed meats? And yes, they are. So in our survey, patients, staff and visitors are being given processed meats, as we have heard, carcinogenic and causing of chronic diseases. Shireen has taken an even much better photograph of that from her hospital, showing sausages and bacon being dished up. Now, in my career, fairly recently, I was a clinical nurse specialist in stoma care. So we had 300 to 400 patients coming through every year in just our hospital who needed stomas forming. 250 of those were colorectal cancer patients. Some of those colorectal cancer patients would have come to us very poorly and post-operatively may have had complications, which might have meant a large wound. And part of our remit as professionals was to look after these wounds and to create special gadgets to be able to manage these wounds. But patients would be in for weeks and weeks and weeks with us managing and helping to heal these large wounds. Now, of course, what I'm going to say is that these patients are mobile, carrying whatever they need to carry and us managing their wound. They could go down to breakfast and they could have bacon and sausages for breakfast. Then they would come back onto the ward and they could have bangers and mash for lunch. And then in the evening, they could then have a ham sandwich. This is totally anathema to what healthcare should be. And I'm ashamed to say that during my earlier period of my time, but certainly while I was a stoma nurse, we didn't have a conversation about these foods. That's very shocking. What are the recommendations? Well, Public Health England, 2016, you can see clearly there, thank you to Doug Bristow, 0 amount of processed meat is recommended. And Professor Wiseman, 2018, he's the World Cancer Research Fund International's medical and scientific advisor. There is no level free of risk. So actually, this is my favourite slide because it's Flo Nightingale, and of course I'm a nurse. So please just read what she has to say there. It may seem a strange principle to enunciate as the very first requirement in a hospital that it should do no harm. Now, in this slide, on the left-hand side, there's the patterning, but it's in shade. And I feel a bit as if, certainly for myself, coming out of the shadows of what was not known, what I didn't know, and what lots of members of the public don't know. We're moving out into crystal clear thinking. It's a paradigm shift, and we need to make the message so clear. We need to make sure that we're not harming our patients. Hospitals are places of education, nurturing, and healing. So, with that passion, I'm voluntary leading the plant-based health professionals in campaigning to make sure that processed meats are removed from our UK hospitals up and down the country. And so really hoping that each member here might feel that they can help us with that, but also in making sure that we get feedback about how we're doing. This is a mini part of the strategy. It's become a little more complicated than this now, but we're just about at stage 3. So there's been a lot of research and a lot of networking, building alliances across the board. We're not yet going out to the general public yet with media, but we're nearly getting there, and we really would value your feedback. We've got a website which has been set up. We're going to show you a short video which was part of the ad, which has been brilliantly done.
I'm Dr. Alan Desmond. As part of my job, I regularly inform people when they've just been diagnosed with bowel cancer. This is never an easy conversation, and it's a conversation that will change their life forever. Cancer Research UK estimates that we could prevent more than half of all cases of colon cancer that occur in the UK through healthier diet and lifestyle choices. In fact, we could prevent over 5,000 cases of colon cancer in the UK each year simply by helping the public to seriously reduce or eliminate one food that is served in our NHS hospitals every day: processed meat. Although the British public love bacon and ham and sausages and corned beef, unfortunately these foods do not love us back. The link between eating these foods and developing colon cancer is so definite that in 2015 the World Health Organization declared that processed meats are grade 1 carcinogens. This important designation is reserved for substances that are known to cause cancer, such as processed meat, cigarettes, and asbestos. But it's not just about bowel cancer. Eating even modest amounts of processed meats will significantly increase your risk of developing a range of chronic diseases, including obesity and type 2 diabetes, heart disease, stomach cancer, and breast cancer. In 2018, the World Cancer Research Fund gave strong advice, stating that people should eat very little or no processed meat. In fact, Public Health England has stated that the healthiest amount of processed meat to eat is none at all. At the core of the NHS are commitments to improve the health and well-being of our patients and to put our patients first in everything that we do. By serving these unhealthy foods, we are endorsing them as healthy choices. This makes no sense. Please join our campaign to get processed meats out of our NHS hospitals. Please help our NHS patients to help themselves by making healthier dietary choices. Let's give bacon the boot.
There's just a last slide which will give you the link to be able to get to the website, to be able to see the information, feedback, tell us how we're doing, join in, whatever you like. All right, so time to be able to link in. Thank you.